There are some questions being raised tonight about that Pfizer vaccine. 2 healthcare workers in the UK suffered severe allergic reactions. WBZ's Dr. Mallika Marshall joins us now to look at this complication. And doctor, the UK is already taking action.
That's right. So UK health officials are warning the public that people who have had a history of severe reactions, allergies in the past, should not get the Pfizer vaccine for now. Now, we're not talking about people with seasonal allergies or hay fever. We're talking about people who've had severe reactions to foods, drugs, medications, and other vaccines. Basically, people who might need to walk around with an EpiPen, for example. Now, of note, the Pfizer trial actually did not include people with a history of severe allergies. We don't know exactly what type of reaction these 2 healthcare workers had, but we hear that they're doing just fine. And we know that vaccines, in very rare cases, can cause allergic reactions, though it's not clear in the Pfizer vaccine what might have triggered these reactions. We're being told that the vaccine does not contain animal protein, like egg, for example, or preservatives that can trigger reactions in other vaccines, but could there be some other component of the Pfizer vaccine which is responsible? So far, we're hearing that the vast majority of people who've received the vaccine so far, and that's thousands of people right now, have tolerated the vaccine well. Obviously, UK regulators are going to take a closer look. Pfizer researchers are going to take a closer look. And undoubtedly, the FDA advisory panel that will be meeting tomorrow will discuss it as well.
Yeah, people will be listening. They want to know that this vaccine is safe. Dr. Mallika Marshall, thank you for some great insight. We really appreciate it.